Welcome everyone to Long Distance Caregiving. This is a community dementia education program of Alzheimer's San Diego. We're a local nonprofit organization, if you're not familiar with us, headquartered in Kearney Mesa, but serving folks throughout San Diego County. And of course, long distance caregivers everywhere who are able to attend our programs via webinar. So welcome. My name is Amy. I am the Director of Education with Alzheimer's San Diego. I'm pleased to be presenting this program here today. I want to just give you a little bit of introduction to how things are going to go and introduce you to my colleagues who are here with me today. On camera, you can see Brooke, who is a social worker on our team. She's a member of our family services team, our clinical services team. And she's going to be with me during the program here today, responding to questions in the Q&A box. I'll show you that here in a second. Sending out resources in the chat and generally being a support if anyone needs it during the program here today. So thank you for being with us, Brooke.
Hi, everyone. Welcome.
And finally, I want to welcome Mona, who is a member of our volunteer tech team. She is here for technical support if you need anything during the webinar. Thank you so much for being with us here today, Mona. I was happy to have you.
Thank you. Hi, everyone.
All right. So with that, let's go ahead and jump into our content here today. So here's what I am planning to cover during our time together here this morning. At least it's morning here in San Diego, where everyone is coming from. But we're going to be talking about why it's so challenging to care for someone who's living with dementia, diagnosed or not. Anybody who's sort of living with memory loss, confusion, disorientation, why that's so difficult to do from a distance. What you can do as a long distance caregiver to support the people who are local, providing care and support to the person that you share your concern for, ways to identify local support. If you need to find a home care company, a good day program, an organization like ours in an area where someone else lives, how do you do that? Connect you to some resources for that. We are going to talk about technology and how it is being used. Of course, that has changed dramatically over the course of the last year. This program, the last time I delivered it, we were living in a very different world. So we will certainly talk about the ways that technology is being used now. Versus sort of broader resources that are available out there and have been. We'll talk about when it is possible for us to visit our folks who are living with dementia, how to plan a positive and productive visit. I know that's a source of a lot of tension, stress for caregivers, as well as the person who's living with dementia at times. So what can you do to make those visits as positive as possible? And of course, as we always do, we'll share some resources with you. So let's go ahead and jump on in, starting with the challenges of caring for someone who is living with dementia from a distance. And by the way, this program, we won't be talking extensively about Alzheimer's disease or other types of dementia. If you need information about the disease, getting a diagnosis, managing symptoms, communication, dealing with behaviors, we have a variety of resources and education programs on those topics. But today we're going to focus specifically on caregiving. So first, I just want to sort of start by defining the term caregiver. We don't actually always use the word caregiver here at Alzheimer's San Diego. We keep it, we use an array of different terminology. Care partner, you may hear us say. In other countries, they use carer rather than caregiver. That's always been hard for me to say, but it's another sort of great word. A lot of people kind of struggle with their identity as a caregiver, I think, because they sort of assume, well, I'm not there giving this person a bath and administering medications. Am I really a caregiver? Right. So what exactly do we mean by that? I mean, we use a very, very broad term. what is a caregiver? Who is it? If you care for someone, if you care about someone, right? Even if you're not in the same city, you're not even the same time zone or the same country, but you spend time, emotional energy, money, right? Your finite resources, concerned about someone, worrying about them, or trying to help them. We call you a caregiver. So that's our terminology. It's very broad and inclusive. We often speak as well about family caregivers, and I just want to be really clear that is meant to be a very broad and inclusive term as well. Family, however it is defined, is family. So, and are you a long distance caregiver, right? Well, if that used to mean something very specific, and these days, right, even to people that live in the same town, because of physical distancing requirements, especially folks who are living in residential care settings right now, you can be a long distance caregiver from around the corner right now, right? So we do recognize that, and everybody everybody is welcome here. I'm going to go ahead and put up a poll. This really helps me to sort of understand who you are as caregivers. I hope that you can see this. It's up on screen. There's 2 questions in this poll, and I'd love to hear from you. Right. Tell us a little bit about your relationship to the person who's living with dementia. Are you able to see and respond to those polls? Okay, I see some answers coming in. So someone's able to. Great. So are you a partner, spouse, or significant other? Are you a child to the person who's living with dementia? Or is that how you identify it? Are you a parent to a person who's living with a younger onset form of dementia? Do you have another family relationship? Are you friends or chosen family, some other relationship? Or are you a professional? We get lots of professionals that come to our programs too. Are you the person who's living with dementia? Here to learn about supporting your caregivers. That happens sometimes too. Or would you define your relationship in another way that I haven't covered? So go ahead and click one of those. And then the second question, I hope you can also see that. Tell me about the distance between you and the person that you're currently caring for. You live in the same state, but a different part of that state. You live in different states, different countries. We do have someone here. Are you in a different time zone? These are, by the way, you can pick multiple answers to all of these. So just click everything that applies to your situation. Are you in a different time zone? Are you local, but you feel like a long distance caregiver because of the restrictions of the pandemic or other? So give just another minute here and then I'll share the results. Great. Okay. So I hope you can see the answers here. But it looks like a good majority of you are children who are caring for a parent who's living with dementia or another diagnosed or undiagnosed type of memory loss. But we have all care partners here with us today, and but a variety of relationships. And as far as the distance from which you are caregiving, many who are caring from out of state, and quite a few who are other or none of the above. So I'm sorry, I didn't quite capture your distance. Again, if you want to, feel free to put in the chat if there's if you want to share something about your unique long distance caregiving situation with the rest of us. You're welcome to do that. But okay, thank you so much. That really helps me in sort of knowing who I'm talking to. These days are very strange for me as an educator to get to know who you are and why you're here. This helps me a little bit. So thank you for indulging me in that and for sharing with each other. And I hope it's helpful to you too. Just to see, whatever your situation is, there actually wasn't a single response in there where only one person fit that category. Everybody is joined by at least one other person here in the webinar we're never alone. Never alone in this. So if that window is still up, you can just exit out and it will disappear in case it's blocking your view. So, thank you. Okay. So why is it so difficult to care for, anyone, not just a person who's living with dementia, but being a long distance caregiver presents a variety of challenges. I think for a lot of people who are caring for someone with dementia from a distance, they're often taken aback by how different that experience is from having cared for someone who didn't have memory impairment or cognitive impairment in the past, for a variety of reasons, right? It can be difficult to get complete information or reliable information, right? To know that the conversation you've had with your loved one who's living with dementia is presenting you with an accurate picture of what's really going on, right? Having a hard time knowing when it's time to jump in and intervene is something a lot of people struggle with. Really wanting to protect and preserve somebody's dignity, their right to self-determination, right? People do get to live their own lives and make their own decisions for better or for worse. And it can be hard, especially for children and grandchildren to know when it's time to step in. I don't subscribe to the notion of parenting our parents. It's not parenting. It's caregiving is something different. But I certainly understand the comparison that is often drawn. It can be really hard, especially for children who have an established type of authority. Wherein you're not usually the one who is telling the other person what to do, giving them advice. You've been the one receiving advice and being told what to do for most of your life. Whether you've listened to it or not is a whole other question, right? But it can be really hard to know, is this the moment are we reaching that breaking point, that crisis point where I really need to step in? And because you don't have the complete picture, you're not right there living in it with them. It can be, even if you feel certain that it is time to step in and intervene, you can be wrong, right? Things could be much more or much less under control than you really think that they are. Even if you're certain that it is time to step in, we really need to bring in some in-home care. We really need to have somebody come in and be filling med boxes for her because she's making errors. You may have a limited ability to intervene. This is a huge obstacle for caregivers, local and long distance alike, right? Having the legal authority that you need to make healthcare decisions for another person, to make financial decisions for another person, to get the mail redirected somewhere else, right? Because it's becoming a problem. So even when you know you should intervene, you can't always do it. We will talk about ways to address these issues, just sort of laying out the scenarios here. Right. A lack of familiarity with local resources. So, it's time to intervene. You've got to you've got to get some more support in there. You really need somebody to start making a weekly visit to fill medication boxes and make sure meds are being taken the right way, for example. How do you find that person, right? Different states have different rules around things like medication administration, what is possible in that person's area, and what resources are out there. How do we arrange them? How do we pay for them? Right. So having a basic familiarity with local resources, if you don't live there, it's really challenging to do that. And then there's just the basic logistics of being a long distance caregiver. Some of you are living in a different time zone, and I know that's a huge challenge just in day-to-day life, finding time in the day to out of your busy work schedule or family schedule to make calls and do research when you need to during the time when local businesses where they are open. traveling, the expense of every time he or she winds up in the hospital, right? You're hopping on a plane or getting on a train or getting in your car and coming to San Diego or going to wherever they live. This takes an enormous toll on you as a long distance caregiver, the time and the money, of course. And then there's the impact that it's just having on your own life, right? Managing your own responsibilities. I've heard it said quite eloquently by a husband who was caring for his wife. This was not a long distance relationship, but she lived in another location from him. And he said, I feel like I have to live two lives at the same time. Right. His wife was living with dementia, and just every bit of the logistics of her life became the logistics of his life. And then he still needed to work and go to doctor's appointments, right, and keep up with the things in his own life. That is a very real challenge, made even more challenging by distance when it separates you. Communication problems, we'll talk about these in some more detail here in a moment, but they're a big barrier for in long distance caregiving relationships. Guilt, right? No matter where you are, if you're local, if you're long distance, almost all of us as caregivers to somebody with any type of disability, we struggle with feelings of guilt that we're not doing enough. We're not doing the right things. We don't know what we're doing. We feel incompetent, right? We worry that we're not doing right by that person, or we're not intervening in the right moments. And I'm here to tell you, no matter how good you are at this, you're gonna second guess yourself, and you're gonna guilt yourself. And this is why you need a support system of your own. Don't spend all your time thinking about building a support system for the person who's living with dementia and neglect your own. It's really important, right? Your roles and responsibilities to each other are changing. If you're a caregiver to a person who's living with dementia, right? Before my parent had dementia, I never had to remind them to take showers. I never had to know anything about their financial situation. And now I'm like all up in their business all the time. There's a lot of difficulty in taking on those new roles and responsibilities, even when you are not met with resistance from the person, but especially when you are. Right? And then, of course, there's just good old family conflict. Old conflicts don't go away during caregiving experiences. In fact, they're often exacerbated, and new ones crop up, right? Everyone has a different perspective. Literally, everybody's got a different perspective on this problem if you don't all live in the same place. So family conflict is even more difficult to manage when people are living at a distance from each other. And then that all gets sort of compounded by the challenges of communicating with each other. So communicating with a person who's living with memory loss or confusion is absolutely challenging on its own. When you are face to face in the same room, there's no vision or hearing impairment, right, to impede the communication. It's still hard, right? So you add on the fact that you're separated by telephones or video screens or emails or text, phones, whatever it might be. You've got that level of separation, and then you've got a person who's living with brain changes related to Alzheimer's disease or some other form of dementia that causes them to rapidly forget things, to become confused, disoriented. It can be very, very difficult to gather information this way. Even if it's, you're not fact finding, you just want to know how they are, right? That can be, you might not be getting the right answer if they're giving you a story of something that happened yesterday, right? It's hard to know how much of that is true. There's also the condition that is labeled anosognosia. An easier way to talk about that is just a lack of insight. It happens frequently in people that are living with dementia, that they don't know that they're living with dementia, right? They don't know that they've got a memory problem, or they're not aware that they're losing their language skills, or maybe their fine motor skills, or that they're struggling with reasoning and judgment and problem solving. So if a person doesn't remember that those things are happening, they're not going to be able to report them to you, and you're going to get the, yeah, I'm doing fine, right? No, I don't need any help with that. Everyone here is good, right? That's not always the person covering up or manipulating you, or living in denial, right? Frequently, it's an actual medical condition wherein their brain is keeping them from being able to understand, gosh, things are changing, and maybe I could use some help here. That's anosognosia, or a lack of insight. There's also confabulation. This is a fancy word for making stuff up, right? And it's not on purpose. Confabulation is something our brains do. All of our perfectly healthy brains confabulate, right? You've seen those little games where there's a word or a sentence and half the letters are missing and you can still read it, right? That's confabulation. Your brain sort of knows how to fill in gaps in what it's seeing and interpreting, and also in a story, right? If things are missing from my home, I can sort of, I didn't see where they went, but I can sort of make up a story and make up a logical conclusion about where they went. Well, people living with dementia have to do a lot more confabulating, right? Their brains are sort of working overtime in that regard because there are more gaps in the memories and in the stories. This is really difficult for you as a caregiver. I know I worked as a private geriatric care manager for many years, and confabulation from on the part of my clients living with dementia was one of my greatest challenges, right? Somebody calling me up and saying, well, my denture broke, and I need you to make me an appointment to go get at the go get it fixed. So I make the appointment, and we go to pick up this client, and they're wearing their denture, right? What happened? Oh, it turns out that was a dream that the person had, right? They weren't lying to me, they weren't trying to trick me, but in fact, that wasn't something that actually happened, right? Her brain had just sort of made up this story about what had happened. A huge challenge, and something that can send long distance caregivers in particular just spinning in the wrong direction very easily. It's the challenge of using technology, even telephones and email, or things that the person has used throughout their life. As their brain is changing, they are losing skills, they are losing abilities. So technology that they already knew how to use becomes more difficult. And then you have the added challenge of damage in the hippocampal region of the brain, which is really essential to being able to learn new skills. So if you're trying to teach somebody who's living with dementia how to use Zoom, how to do a FaceTime for the first time, and they're already sort of mid-stage, they're going to have a really difficult time. If not, it may actually be impossible, right, for them to learn how to use new technology. So this creates an enormous challenge if the way that you and your family communicate is not a tool that this person has access to or the ability to use. Hearing loss, a tremendous barrier to communication, again, even in person, but certainly when you're long distance. Hearing loss is something that we really have to address throughout our lives. I mean, hearing loss affects 1 in 5 people of all ages, 1 in 3 people over age 65, and large percentage of people who are living with dementia. So if we can continue to keep up on top of their hearing health and make sure that they've got access to hearing aids and the batteries are in and that they fit properly and they work properly, this can help overcome a bit of those communication challenges. And maybe the most important of all these challenges, this final one here, just kind of an overall general lack of context, right? When you're talking to someone, I mean, these days, because we are using more video conferencing, I think we're feeling like we have more context on situations because we can we're not really looking someone in the eye, but it feels like we're looking someone in the eye. We may be able to, see the pallor of their skin, the quality of, how clean they look, right? What is the background? Does the house look like a mess? Or, you can get a little more context this way, but I think after 10 months of living in a pandemic, we're all aware the context isn't perfect, right? There's still so much that we miss in a conversation. And if you're communicating primarily by phone with somebody who's living with dementia or not at all directly, right? Many of you may just be communicating through other people, right? Not communicating directly with the person who's living with dementia. There's a lot that you're missing, right? And there's a lot that you need, right? Your information needs are legion. You need to know how's this person doing in terms of their health, what appointments are coming up, and I don't want to miss something. Do I need to get some information to the doctor in advance of that appointment? And they could be making appointments without telling you, missing appointments. They don't know that they've missed the appointment, so they're not going to be able to report that on to you, right? Your information needs as a caregiver are great. What's going on in the household, right? Who's there? Who's visiting? Are there phone solicitors making visits or making phone calls? Is there mail coming into the house that shouldn't be? Meaning, solicitations for either for products or scams, or even well-meaning charitable donation requests, right? A person living with dementia may not have the ability to filter, yes, I do want to donate to this organization, versus no, this is not an organization that I can or want to support. You need, certainly as a caregiver, depending on your role and your relationship as a caregiver, you may need financial information that can be very difficult to get because the person living with dementia doesn't want you to have it, and the bank probably doesn't want you to have it either. These are big challenges. And just sort of general day-to-day, how is this person's life? How is their overall well-being? It can be very hard for us to sort of grasp that. So a couple of tips on improving your ability to access information when you need it. Now, I recognize that you're all in different sort of phases of your journey as a caregiver. So for some people, it's too late. I recognize that, to procure some of these things. For some of you, it's not. So we'll sort of cover these documents in very general terms. But please reach out to us if we can support you by connecting you to resources for these things, connecting you to professionals who can help you with these things. Or if you are in that sort of unfortunate gray area where you don't have these documents in place and the person has lost decision-making capacity, there may be some sort of legal steps that need to be taken. So we can point you toward resources, certainly here in San Diego, but maybe even elsewhere if that's needed for following up on these things. And I just want to say at the end of the slide deck here, at the end of the program, I will be providing you with some specific resources for many of these types of documents if you need more information. So just a couple quick points to cover here to ensure your access to information about the person when you need it. Both being able to get information as well as being able to share information as needed. Information needs to flow both ways, right? When we're acting as a caregiver. So actually, I'm going to start with the second point. Powers of attorney, critically important, right? Somebody needs to be designated to be that person's agent for making decisions, either or both for healthcare as well as for finances. Powers of attorney, durable powers of attorney. There are two forms. There are two types, I should say. There's the healthcare agent, and then there's the sort of estate or financial agent. You'll hear different terminology for that. Sometimes referred to as a general power of attorney. Right? That's the person who can write checks, make financial decisions, right? That type of thing on your behalf. Your healthcare power of attorney can make healthcare related decisions for you. These can be the same person. They often are the same person, but they don't have to be the same person. Two different people can be named. If you are caring for somebody who's living with, early memory loss, early stage dementia, right now, and I mean like today, is the time to have the conversation about whether or not powers of attorney documents have been drafted. Having a diagnosis of dementia does not mean a person has lost decision-making capacity and can't draft new documents or update their documents. They can, as long as the attorney or whoever is witnessing the document being signed, created or signed, as long as that person is confident that they've got decision-making capacity. It is not a diagnosis of dementia that determines whether or not somebody can make a decision like that for themselves, right? It's how much ability they have in that moment to understand, right, what they're signing, what decision they're making, and the consequences that it will have. These are big and complex topics that we dive into much more in our legal and financial basics class. If you want to sign up for the next one, it's coming up in February. I'll leave it at that, but I want to say that if these documents are not yet in place, or if they need to be revisited or updated, the fact that a person has a diagnosis of dementia should not be an impediment to having that conversation, right? Find out whether or not they can update those documents. Somebody needs to have those permissions. If you wind up in a situation where nobody has those permissions, right, this is where we talk about conservatorship. In other states, this may be referred to as guardianship. In California, we call it conservatorship, where somebody else really needs to step in and officially be that person's surrogate, right? A fully conserved person. Advanced healthcare directives. These are supplemental documents that can either name the power of attorney for healthcare, that it names the healthcare decision maker and gives them detailed information about what you do and don't want in the way of healthcare, long-term care, end-of-life care, hospice care, death care, for example. But the Advanced Healthcare Directive can also be a supplement to the power of attorney document. It's just a detailed directive that gives instructions to or guidance to the person who may need to make healthcare decisions for another person. Again, now is the time to have find these. You can find free downloadable versions of these directives online. And again, I've got a resource for you at the end of the program that I'll share where you can get these things for free, or certainly if you're working with an estate planning attorney, these documents are sort of crafted and built into a good estate plan as well. HIPAA waivers and other release forms. This is to ensure that you're able to talk to a doctor if you need to, or a hospital, or a skilled nursing facility, another healthcare provider. HIPAA is the federal law that protects the privacy of our health information. And it's a good law, but it really stands in the way, gets in the way for a lot of family caregivers, especially the long distance caregivers. So if a doctor's office, a hospital has a specific form, find that, get that from them and get that signed so that there is permission to give and get information as needed. There are also just sort of statutory boilerplate HIPAA forms that you can download, but I would recommend talking to the particular healthcare providers that serve the person that you're caring for and finding out, right, well, what do they use and what do they need? Banks and other account signatories, this gets tricky. This is very institution specific. Certainly you'll want to have that power of attorney for the general power of attorney, the ability to make financial decisions on another person for another person, if at all possible. But there's also ways that you can work with the bank to be added as another signer on an account, to fill out specific forms that financial institution requires in order for you to be able to give or get information to make financial transactions on behalf of the person. You don't want to find yourself in a spot where you're able to, and you need to make sort of emergency healthcare or custodial care related decisions for somebody who's living with dementia, and nobody's got the authority to access the funds to pay for them. Right. So talk to, of course, if you can, it's in an ideal world, you have this conversation with the person who's living with dementia and say, what am I going to need down the road in the way of permissions and access? They may or may not give that to you, right? So have the conversations now with an elder law attorney, with the bank, where they bank. Do what you can now to sort of find out what you're going to need down the road in order to get this access to information. we'll pause here, and I'm going to shift gears and talk about ways that we can support local caregivers, and find local support. And then I just want to say that we are going to pause for questions after that. So please, if you have questions, you don't need to hold them. You can ask them now, submit them, and we'll pause and answer them in a few minutes here. So what can we do to support those folks who, if we're caring from a distance, often I mentioned before, we're feeling guilty that someone else is sort of saddled with a lot of the in-person, the legwork, right, of being a caregiver. What can we do to better support those local caregivers? And I mean, I want to also be mindful. I don't mean to assume that caregivers always have healthy, productive, good communication between them either, right? I know that there's often barriers in between family members, or maybe the local caregiver is a neighbor or a friend from church that you don't really know very well, right? Trust can be a huge issue. I absolutely acknowledge that. So start by asking them, right? What do you need? How are you doing? How can I be most helpful to you? Right. And really listen to what you hear or what you don't hear. Right. Ask them for what they need. Doesn't mean you can do all of those things, but it's a really good way to sort of open up that door and get the communication flowing between you, if it can be and if it should be, right? So ask, what can I do to be helpful to you? I mean, a lot of caregivers who are local just need to sort of be seen and heard by other people in the person who's living with dementia's life. The other people know, I'm trying, right? I might not be doing this perfectly. We call this validating the person, right? Just saying, I see what you're doing. I know that you're trying to be helpful. Let me know what I can do, right? Think about your own strengths, limitations, right? Don't just leave it sort of wide open. Tell me what I can do, or if you need anything, call me, right? Because the person may not be able to think or know exactly what it is that they need, but B, what they need may not be something you can actually deliver. I mean, okay, great. Can you come out here and stay here with her for a week, because I need a break. If that's not something you can do right now, right? You don't want to leave that door wide open and then create more tension between you. Know what's really possible for you, know where your skills are, and offer those things, right? Making a very explicit offer of assistance would be my advice, right? Would it be helpful if I came out for a week? Would you like me to do some research on local adult day programs to sort of take some of that load off of you, right? Think about what your strengths, what are the things you know, and or the things that you could learn, and also be realistic about your limitations, right? How much time you really have to devote to helping the person with dementia as well as helping that local caregiver. Think about how you might be able to adapt your schedule in order to give that primary caregiver a break if you can see that they're really overloaded, burdened, close to burning out, or officially in burnout, right? We gotta do something to support that person and give them a break. Nobody can be the one-on-one, hands-on, direct care partner to a person who's living with dementia 24/7, indefinitely. And people need a break from that. You might not be the one to give them that break, right? That, let's be realistic here, but maybe you can help them identify resources in their community for more support. Uh, if you need more disease education, if you need more skill building in terms of learning how to communicate, or if you can help them connect to resources for education or skill building as a caregiver, this can really help both of you. Something that's great about online education that we've learned here at Alzheimer San Diego is that now frequently, more than one caregiver from a family can watch our webinars together, right? They can learn about communication techniques, or what these challenging behaviors are all about, and how to respond to them together at the same time, in ways that we couldn't do when we were providing education all in person before the pandemic. So find those opportunities to attend webinars together, get resources and share them with each other. Um, This can be really helpful because, again, it kind of gives you all the same language, the same vocabulary to work from. And then, of course, helping out with the identification of local resources is hugely helpful. So what do I mean by that? What exactly do people need? All kinds of things, household, people to help out around the house, shopping and errand services, transportation resources, social activities and emotional support, um, professionals who can come in and assess home safety and make recommendations for home modification, medication management. I've used that example a couple of times because it is such an important, critically important sort of intervention that a lot of people need to make pretty early on for people living with dementia. Bill paying and financial management. We'll talk about resources for this here in a second, but finding qualified, credible people, right, who can step in, sort mail, pay bills, that sort of day-to-day stuff, daily money management, as well as higher level financial management if it's needed. Legal help, right, finding somebody that knows the laws, knows the documents in that person's state is really important. And then, of course, those sort of long-term care resources, in-home care, adult day programs, residential care, meaning assisted living or memory care or skilled nursing facilities. And then, of course, like the logistics of if we're going to be relocating someone and I'm 3,000 miles away, how do I find somebody that can help kind of pack and move them? These are all the things I could think of in terms of the resources I hear family caregivers asking for and asking about. Let me know. Feel free to put it in the chat if you want to, or ask a question if you have one. If there's other sort of things you have found that you need as a long distance caregiver that aren't mentioned here, let me know. I'd love to sort of add those to our list. So once you sort of know what you need, how do you find that actual person or resource or service provider for that? So start, if possible, this isn't always possible, but if you can, start with that person's local support system, right there. If they have a network of friends they've had coffee with for years and years, and you know any of those folks, reach out to them. Ask them who they've worked with, who they've used. Talk to their neighbors, talk to members of their church, their synagogue, their book club, talk to their doctors, right? Whatever it might be. If you have access to members of their local support system, recognize how powerful, how helpful it will be to you down the road to build your connections to their village, right, to their network of support right now. This feels sometimes like an invasion of the person's privacy. I absolutely understand that. But when it comes to a person who's living with, cognitive impairment related to a progressive form of dementia, we're going to have to be sort of in their life and in their business, and unfortunately sort of invading their privacy at some point. So build those relationships early if you can. Find out who their friends are, give them your cell phone number, right? Start building that communication. Outside of that, right, maybe you can contact other professionals that support them, doctors. Their CPAs and accountants are amazing resources, frankly, for family caregivers. Often a person has been seeing their accountant or their tax person for years and years, and that person knows them a lot better than you'd think. I've seen professional advisors come in all shapes and sizes. The folks that know your person, think about their lawyers, their specialists, right? Whoever it might be. Even their longtime housekeeper, right? Those folks can be a wonderful source of support and giving you ideas about not only information about the person, but we worked with this really wonderful in-home care provider last year. Here, let me give you the owner's name, right? If you don't have those relationships, and I know many times people don't, know that every region of the country in the United States, if you're caring for someone in the US, has something called a AAA, the Area Agency on Aging, and you can find the local AAA through this website here, eldercare.acl.gov. And through the local Area Agency on Aging, you can get connected to housekeepers, in-home care companies, day programs, memory care providers, right? Those types of things. If they have a local dementia provider, an organization like Alzheimer's San Diego, of course, we're a great resource to people who need local resources here in San Diego County, right? We're very up, we're local, we're here in this community, so we can talk to you about the pros and cons of different providers of services. Talk to the local senior center, get in touch with the public library. There's community centers, right? So many of these local resources maintain lists. They can connect you to providers that the person living with dementia may not be able to research or find out about, right? And then of course, there's Google, right? There's lots of registries and online resources. Be careful, of course, but I mean, the internet is where most of us go first, and for good reason. But of course, always do so with caution. Please don't hire caregivers through Craigslist. I'll just say that right now. Two resources in particular I want to make sure I've mentioned: aging life care professionals, as well as professional fiduciaries. These are private professionals who are paid on an hourly basis. They're not free, but they can be, if you or the person you're caring for have financial resources, these professionals can be hugely helpful. So an aging life care professional, this is also commonly referred to as a care manager. This is the work I did for many years prior to my role here at Alzheimer's San Diego that I was referring to earlier. Most aging life care professionals have a background in social work, nursing, counseling, an industry like that. And they can really walk people through all of these resources that I'm talking about: navigating the long-term care system, being a liaison, right? Being a set of eyes and ears for the family if folks are long distance, or even if they're not, right? And they want somebody who's objective and professional in their assessment of what's going on. They can come in and just do sort of an assessment and help you develop a plan, or they can stay involved on an ongoing basis and serve as an advocate, right? Really kind of navigating people through these challenging waters. But I think the greatest benefit that they offer is that they just help people sort of see with more clarity the situation, right? They don't have all the history and the emotional attachment to the people and to the issues. Not to say they don't become attached to their clients and their families, but they don't have the history that sort of clouds judgment, right? They can really provide a good objective view of a situation and give you good advice. So the Aging Life Care Association, their website is here on this slide. And again, you're all going to get a copy of that. Can be a great resource for finding a local referral. We can connect you to the local folks here in San Diego County if you need one, but they exist all over North America, really. Professional fiduciaries, another type of private professional. These are individuals who are licensed here in the state of California. Anyway, they're licensed. In other states, they're not necessarily licensed. Who can act in a variety of representative capacities. They can serve as a trustee. They can be the person's agent for power of attorney. They can be their guardian. They can be their conservator. They can execute estates. They can also do sort of day-to-day money management, represent a person in the hospital, right? Being their advocate in that way. They often work closely with aging life care professionals, but they can also work independently. So they're called professional fiduciaries because they assume fiduciary responsibility for that person. They are often named by, in the court system, in the probate system, somebody who can't make those decisions for themselves anymore gets assigned to fiduciary, gets named to be their representative. But we as individual people, we can hire fiduciaries to serve in that capacity. It can be very, very helpful for long distance caregivers. So I'll pause here for a moment. And Brooke, let me know if there are some unanswered questions I can tackle.
Yes, so one of them here, going back to kind of the challenges in communication, having incomplete information, this person says they don't have access to their mom's doctor or communicating with her doctor. They say, how do I decode what is told to me about my mom's progress? So I assume, health progress. If so, any tips for getting involved in that if you don't have access to the doctor.
Yes, that's really challenging. Sometimes the best that we can do, I mean, of course, I encourage you to tackle getting official permission, right? Call the doctor's office and say, listen, what forms do you need in order for me to be able to to get direct information from you, and see if you can't get those forms filled out either by the person living with dementia or their local representative. In the absence of that, I know that's not always possible. I would say that remember that communication can also go one way. So, what I've often advised to families is if the doctor can't communicate back to you, you can always communicate directly with them, right? Get a fax number, get an email address, send letters, whatever method works, and say, right, here's the situation as I see it. Here are my concerns. I'd really appreciate it if at your next visit you would ask my mom about XYZ, right? Or explain to the physician or to the provider, my sibling is going to be at that appointment, right? Please give them this information. See what you can do, what you can orchestrate from your end of things, and remember, you do have the power to direct information their way, even if you can't get it back. And then again, if there's somebody else going to those doctor's appointments with the person, and somebody should be, opening up the lines of communication between you and that person, so that they, you can feel more confident in the reports that you're getting. In a moment, we're going to be talking about technology resources, and that's another thing that could be really helpful. Sort of setting up a shared Google Calendar or a shared communication portal where the caregiver can put information in there about how the appointment went, and then you can read it. Right. So we'll talk more about that in a moment.
Okay. And then just a question about communicating with, when the person's in a facility, communicating with staff and trying to navigate, especially the confabulation or getting that incomplete information from the person.
Yes.
Any advice on communicating with staff?
Oh, that's such a hard one. And I'll also say we have a class on this topic. It's called After the Move to Memory Care, and you can find a recording of it in our webinar library, and we'll do it again live in the near future. But we talk a lot about how to work collaboratively and effectively with facility staff. So just a couple kind of quick tips, though. I'd say just opening those lines of communication, letting them know I'm on your side, right? I think often these relationships can feel kind of adversarial. They feel attacked by you. You feel like they're hiding information from you, right? Just do what you can, either to start fresh, or if you're starting from the beginning, let's have a partnership here, right? I want to support you in providing good care to my loved one. And I'm going to believe you, right? Give them the benefit of the doubt that they're not trying to manipulate you, right? Unless you have reason to think that might be the case, right? Open up those lines of communication early on. Don't assume that everything you hear from the person who's living with dementia is accurate, right? I didn't get lunch yesterday, right? Probably not true. It's okay, right, to question and to ask those questions, but don't sort of come at those communications in an accusatory way. Yeah.
All right, that's it for now.
Okay, great. Okay, I will keep us moving on. We're going to talk about technology solutions here. And before we do, I want to show you this short video. I watched this at the American Society on Aging conference a couple of years ago, and just absolutely love it. That shows us, it's a good reminder of the limits of technology. So I'm going to click play here and hopefully you'll hear it.
Another shipping forecast issued by the Met Office at 22:40 on Saturday the 18th. There are warnings of gales in all areas except Trafalgar. The general synopsis at 1800, Iceland 960, drifting slowly east and filling. Low 250 miles northeast of the Faroes 9540 by 1800 Sunday. High Trafalgar 1033, slow moving with little change. The area forecast for the next 24 hours. Viking, North and South Utsira, 40.
Is it Chinese? Is it Japanese? James thinks it's Chinese.
This little vase is Japanese, and there are
How could you tell?
well, there are several things that we look at. If we first look at the little band that encircles the neck,
Seriously, do you know? I've never heard.
they say 150 pounds, 150. Any advance in 50. Any advance in 50. 80, 90 pounds. Any advance in 90 pounds. All done at 90.
29% swing.
We are seeing the entire shape of British politics changing before our eyes.
Look at that. It is right up. It's almost breaking our swingometer.
Horrifying column that for the Lib Dems, down 27%.
Viking, northwest 5 or 6. Wintry showers, good, occasionally poor. North at Sierra, south at Sierra, east 40s. Variable 4, becoming southeasterly 5 or 6. West 40s, Cromarty, Forth, Tyne, West Dogger.
Noel Wiley, no red line for you as your high scores, but let's see, Noel Wiley, is it right? How many people
Serving a captive all on here, 254.
No, I think you probably will. I mean, it comes down. I tell you what, you've got several years of Sundays.
Okay.
I can heartily recommend.
To do the pointless thing of making up names. And that stacks the odds against me.
Yeah, I'm thinking Brown's
Now in winter, the sharks are focusing all their attention on the offshore islands, full of young seals. By watching how the sharks hunt here, Alison has learnt what time of day an attack is most likely.
Here is the general synopsis at 0700 GMT. Cow in sea area Shannon moving slowly eastwards and filling. Sorry, that should be low in sea area Shannon. And now the area reports. Viking, north at Sierra, south at Sierra, rain at times, good. Westerly becoming cyclonic, good. Humber, Thames, Bedford, Leyland, Daff, Dover, Seoul, Hake, rain at times, good. White, Portland, Plymouth.
Now, subway systems from around the world. Will you either tell us in which city of systems, please? Best of luck.
Okay, let's reveal our 5 subway systems, and here they come. We have got that made you think Paris. New York City from Andy and Julia. 50. David and Rachel are going to say. Is it going to be 15 though? Down to that 7. Very well done indeed.
To the answers I can make, this is so many films and what have you, isn't it? Now, A is London.
Chink of light getting inside the telescope. The astronauts had to get the latch to lock.
If you copy, Jeff's just working, putting the doors back together and thinks he needs to close the gap. And we're going to press on. If you've got a way to do it, do it.
Trap and a ratchet. Floating Story Musgrave improvised a solution. It was a success. The astronauts were elated.
I love this. I'm going to get my video back on here. Okay, back. I just love this little reminder of a couple of things. First of all, I'm sitting here with a smartwatch that has been beeping and telling me to stand up as well. So I know the irritation and the annoyance that these technological advances can bring to our lives, as well as the positive things. But those children, right, those sweet notes and the text messages and checking in on his statistics, they are loving and well-meaning, but there are limits, right, to the ways that technology can be used, the amount that people really want technology sort of involved in their lives, and also the limits of the data, right? It looks like he's walking his 2,000 steps, but right, he's just paying off the local kid to help with that. So those issues may not be going on in your life or the life of the person that you're caring for. But technology, while it has lots of challenges, there's a lot out there that can really be used in effective ways to support us in getting information and sharing information when we need to, and just sort of the practicalities of day-to-day life for people that are living with dementia. I want to just say, at the outset, technology is not a substitute for people, right? People living with dementia, especially those who live alone, we need human support systems as well. But technology solutions can be a wonderful sort of bolster to that to help you get better information. And by the way, I'm going to go through a couple of lists here of technology solutions that exist. We have lists of other resources we can send you. Brooke, maybe if you could put the link out in the chat to request follow-up from one of our social workers. They can connect you to resources if you're looking for something specific. But I want to also welcome all of you. If you're using something as a long distance caregiver that's working really well for you as a family, please share it. You're just in the chat, send it to all panelists and attendees so everyone can see it. That's a wonderful, I've just got a couple of suggestions here, but you may have more, and I'd love for you to share those. So if ideas come up, something you want to share, please feel free to do that. So a few different types of technology solutions exist. And again, these are just sort of what's currently available. There's lots more in development, and each of these are just a couple of examples of what's out there. We don't mean to recommend, refer, or endorse any particular company for any of these. We just want to give you a couple of examples. So automated check-in calls and reminder systems, as you saw in that video, there's limits to what they can tell you, but it's a great resource. Caregiver Action, Care Angel at Caregiver Action is a nice online resource for setting up automated check-in calls. There are also, like here in San Diego County, we have volunteer daily check-in calls that are made by humans, which I absolutely recommend if such a resource is available in your area. Find those, right? Contact your local AAA again to find out about daily check-in calls. These are sometimes referred to as telephone reassurance programs. But people may live in areas where that's not available, and there are automated systems you can sign up with. Personal emergency response systems, very important for especially people that are living alone who would be able to remember to push a button, or if it's a person who's living with dementia who might not be able to remember to push, the pendant or the wrist pendant, the wristwatch that calls for help. If they've got a care partner living in the house with them, a spouse or somebody else that lives there, they might want one of those emergency response systems in case something happens to them, right? Because the person living with dementia may not be able to call for help for them. So a couple good providers of that: Philips Lifeline, Life Station, wearable activity trackers. More and more people, as you saw in the video, are using smartwatches, Fitbits. There's something called the foot logger to track whether or not a person is sort of moving around enough during the course of the day. Information portals. These are what I was referring to a few minutes ago. These are really neat websites you can set up. CareSair is a mobile app. But Caring Bridge and Lots of Helping Hands are websites. You can set up a secure online portal where you decide who has access to it. So it is not like putting everything out there on Facebook or, just sending, you don't have to send an email out to everybody and keep everyone informed. You put information about what's going on, what happened at the last doctor's appointment, the results of their last MRI, whatever it might be. You put the information in the information portal, and then anybody who wants it can log in and get the latest. You can share caregiving calendars, you can share schedules, task lists. This is a wonderful way to organize a group of people that are trying to care from different locations. Communication tools, just meaning, phones that are easier for people who are living with dementia and memory loss to use. Great Call is the maker of the Jitterbug that most folks have heard of, but they have other really neat communication tools as well. LEQ is a really cute. I recommend going to this website just to check it out. It's a little personal sort of communication robot, really, and it's pretty adorable. It's currently in beta testing mode, so you can actually try it out for free if you're interested. A little robot that makes calls and sort of sends updates and keeps long distance folks in touch. It's very sweet. Automated pill dispensers. This gets tricky. I'm of a mind to say, medications should really be organized and monitored by humans whenever possible. But in the early stages of dementia or people that don't have significant memory problems, automated pill dispensers can be very helpful. So a couple of examples here: MedMinder, the Live Fine company. Health and safety monitors and sensors. These are fall detectors. People or devices that can detect when somebody's had a fall, when somebody's had an event and needs emergency assistance. ADT, the home security company, actually has a product line of health monitors, health sensors, as does a company called Lighthouse Caregiver Systems. Remote door locks and security systems. This seems like a pretty simple thing, but it can be hugely helpful as a long distance caregiver. They're forgetting to lock the doors and the windows at night. You can actually do that remotely through a couple of services. GPS and wandering response programs. So personal GPS is something a lot of people are using now for wandering response, right? Somebody gets lost, you can look them up and, on their smartphone, on the tile, on the GPS device that's inserted in the sole of their shoe, and you can locate them. These devices are still fairly expensive and kind of out of reach of most people, but they are available. So a couple of resources there: the Lively, which is produced by Great Call, and Yepson is another sort of GPS, personal GPS device that can be used. But there is cost, of course, associated with all of these, but in particular GPS, you have to buy the device and then you have to pay for a subscription service. So you can also try things like the tiles that can connect to a set of keys, or tie into a shoe, the shoelaces, a smartphone, turning on the location finder if the person would be likely to bring their phone with them, right? If they took it when they wandered. But at the very least, right, we certainly recommend getting the person enrolled in a wandering response registry if your region has one. We do have one here in San Diego County called Take Me Home. That's free, right? There's no technology involved there. Fall detectors, kind of along the lines of the health and safety monitors. Great Call's Lively device also will detect falls, as well as first response system. Again, thank you. I see that some folks are putting some ideas in the chat. Thank you for that. I appreciate that. Feel free, keep them coming. Video conferencing, right? This was something that a year ago, almost none of us were using with our older family members, older relatives, or people with dementia that we were caring for, but it's pervasive now. Of course, Zoom is a popular one, FaceTime, Skype. You can use Google Hangouts, House Party, all of those are free. Jitsi is one that I think has a small fee associated with it. But there's lots of free apps out there. Just a couple of tips. We actually have a really great post on our blog at Alzheimer's San Diego on using Zoom and video conferencing technology with people who are living with dementia. Because we know a lot of people are using this personally for personal communication, but they're also using it to communicate with someone who's living in residential care, communicating with the staff. It's become a very important communication tool. So just a couple quick tips from that. Of course, doing what you can to ensure a stable internet connection. That can be so frustrating and confusing to a person who's living with dementia when the connection is poor, there's lag, or you keep disappearing on the call. Minimizing distractions for you and for them during the call. Try to schedule those calls, have those calls in places where it's quiet, and they can have I have a very sort of unfortunately, tight view of my face on this camera, right? That's very helpful to people that are living with dementia who are watching our webinars, right? To be able to really see the person's face. You don't have a big wide lens with lots going on in the background or the foreground that can cause confusion and distraction. In all likelihood, the person who's living with dementia will need somebody to help them, right? Having staff at a care facility, a neighbor, a friend, somebody who can help them, get this call started, get the technology set up and figured out. Please just, remember the limits of what a person who's living with, progressive brain changes related to dementia, what they can learn and what they can tolerate, right? We don't want to push and challenge people beyond what they can do, right? Learning new things becomes very difficult, and you're not setting either of you up for a good and positive communication if you're just sort of pushing past that point, right? So treating these situations with as much empathy and patience with yourself and forgiveness, I should say, as you can. Any other types of technology that any of you are using? Let's see. Oh, I see. Brooke, if you would, a couple of suggestions were, or maybe just one, added into the chat, but it went just to us, the panelists. The attendees can't see it. Could you copy and paste that so everyone can see it? If there are other technologies that anyone is using as a long distance caregiver, we'd love to hear about that. I've seen that folks are using Alexa and Echo to communicate or to set reminders. Can be very helpful. Reminders are a tricky business, right? When it comes to people living with dementia, reminders are great for people who don't have a pathology in their brain that makes them rapidly forget things. If you have Alzheimer's disease or another form of dementia, right, you're very likely to reach a point where that reminder going off doesn't actually trigger, you might hear the sound, but it doesn't trigger what it's supposed to trigger. So just remember that there are limits to the usefulness of reminders. Teepa Snow is a wonderful occupational therapist and dementia expert who I was trained by and continue to learn from. And she often says, if dementia was just a memory problem, well, reminders would help, right? And it's a really simple way of thinking about the usefulness, I think, of some of this technology as it relates to people who are living with dementia. So please feel free to keep your suggestions coming in the chat. For now, I'm going to move on and talk a little bit about planning for positive and productive visits. Now, right, visiting at the moment is very challenging for obvious safety reasons, but we eagerly anticipate a time that we can all be together again. So join me in thinking about the future where we get to visit each other at the holidays and family gatherings again. I really recommend, if there is a primary caregiver who's local, coordinate with that person directly. Ask them, tell them when you're planning to come, ask if it's okay, right? Ask what they need. Do a little check-in, right? What's changed since the last time I was there? What do I need to know? Both in terms of my own personal preparation for what I'm going to encounter. Like, the person has dramatically changed since the last time you saw them. It's good to have a heads up on that. They may not know. They may, they're often so close to the situation, it can be hard for them to advise you in that regard. But if you haven't seen or talked to the person in a while, it can be really helpful for you to have that preparation. But also, just what do I need to know in terms of the practicalities, right? If there's a certain topic I should avoid bringing up, right? Something that tends to sort of spark behavioral problems or challenges, right? What can I do to make my visit easier, both for the person who's living with dementia, but for you as a caregiver? This is you can't always deliver on everything they ask for, but just being asked can be really helpful to that caregiver. And having had that conversation before you go will be helpful to you. I am certain of that. So ask. and don't be afraid to be very direct about those questions in a way, of course, that doesn't, put the caregiver on the defensive. Just asking, how are things going, right? What do you need, and what can I do to make this something that's helpful to you? If you're somebody who travels frequently to see a person who's living with dementia, just think about what you can do to make your life as a traveler and as a caregiver a little easier. This was a very simple but sort of mind expanding suggestion that one of our family caregivers gave to me. She visited her father in Texas frequently. Of course, this is pre-pandemic, and just eventually set up a little case for herself in his home where she kept her supplies. So every time she went, she didn't have to, bring her walking shoes and her toiletries and her sundries. She had a little store of supplies, which made her back and forth a lot easier. I love this idea. So I like to share that one whenever I can. Think about the logistics of your visit, where you're going to stay, how close you're going to be, if you're going to be in their home, right? Consider the length of your visit, and make it appropriate, what you can tolerate, what they can tolerate, what's sort of reasonable and manageable for you, but also what's not going to completely wear out the person living with dementia. Remember that your visit is a disruption to their life. As much as it might be a welcome disruption, it is. It's going to throw them off their routines, and that's probably going to have consequences for the person living with dementia as well as the care partner, right? It may disrupt sleep. It may disrupt appetite, change behaviors, cause a little disorientation. It's not to say it's not worth doing, but just be aware of that and sensitive to those changes. Think about your own self-care needs. Don't jam pack your visit with so many tasks, so many, even if they're fun things, right? But often this isn't what caregivers do. They swoop in and they make 30 doctor's appointments and, try to take care of buying all the supplies that are needed and, doing. Make sure that you're building some time in during your visit to attend to what you need. Are you going to get time to get outside for a walk, have a healthy meal, call back home and talk to your own family, right? Whatever it might be. And really importantly, don't forget like the whole point of the visit. Often we do that. We kind of drown in all the stuff that needs to get done. And we sort of forget that we're there to spend time with the person. So don't forget, spend some quality time together. So before we take a final question break, see if there are any questions, I just want to make sure you know where to find resources, both here in San Diego County, as well as what other location you might need to look for. So this is us here in San Diego County. Again, we are a local nonprofit organization providing an array of totally free supports and services. If you need connection to attorneys, HIPAA forms, advanced healthcare directives, in-home care providers, day programs, medication reminder systems, right? Whatever it might be. This is what our clinical services team, Brooke and her colleagues, this is what they're here for. Monday through Friday, 8:30 to 5, you can call, you can email, you can live chat us. We're here to connect you to those resources, as well as an array of other supports. We have support groups for care partners. We have lots of education, of course, and training. We have volunteers like Mona, the members of our volunteer tech team who can work with you to set up those, getting a FaceTime sort of plan working in your family, in your household. Our volunteers can work with you one-on-one to get those things set up. We have social activities and outings, all of course virtual at the moment, but we'll get back to in-person eventually. We have Vitals is our Volunteers in Touch program. This is our telephone reassurance, our telephone check-in calls for people with dementia who are living alone. Can be a great resource to long distance caregivers who can't be there. We provide counseling sessions to caregivers with a licensed clinical social worker. Virtual All's Companions is our respite program, now virtual, but someday we'll go back to being able to make in-home companion respite visits where we have trained volunteers that are paired with families matched with families to provide 4 hours a week of just friendship and connection and give those care partners a break. But right now they're making virtual visits, which is still a lovely sort of mental break for the caregiver and a different type of stimulation for the person who's living with dementia. And lastly, but not unimportantly, we have a really lovely supply of cloth masks for anybody who needs them. We've had volunteers sewing for us. If your stash is getting a little ratty like mine is, let us know. We can send you some more. So that's us at Alzheimer's San Diego, but we are just one of many terrific sources of support here in San Diego County. One in particular I want to make sure you know about is the Southern Caregiver Resource Center, free caregiver support services for folks here in San Diego County, but they are part of a network of what's called the Family Caregiver Alliance. There are resource centers like Southern Caregiver Resource Center. I believe there's 9 of them in California. At caregiver.org, you can find the location of the California resource centers, and the Family Care Navigator. You can find state by state caregiving resources through that website. Some of the planning resources that I mentioned before, Compassion and Choices is a terrific organization for sort of conversation starters as well as documents related to advanced healthcare directive planning, powers of attorney, end of life sort of conversations and planning. If you need a connection to an elder law attorney, again, here in San Diego, we can connect you to our local community of attorneys who specialize in estate planning and elder law specifically, but NALA, the National Academy of Elder Law Attorneys, can refer you to resources in other parts of the country. Remember that attorneys are licensed by state, so you need somebody that knows the laws in that person's state. The National Association of Senior Move Managers, these are professionals you can hire to help with packing, sorting, getting rid of stuff, in the event that somebody is making a geographic move, either local or across the country. If you're looking for an organization like ours at Alzheimer's San Diego, we do have a couple of sister organizations here in Southern California, Alzheimer's Orange County and Alzheimer's Los Angeles. Between the 3 of us, we do sort of cover the entire Southern California region, but we are independent organizations. We are not part of a national network. If you are looking for resources outside of Southern California or anywhere really, you can contact the Alzheimer's Association, which has chapters around the United States. And ADI, Alzheimer's Disease International, you can find national dementia advocacy, information and advocacy organizations worldwide through their website. I haven't come across a country yet where I haven't been able to find a resource for a family. So any questions before we wrap up here?
Just a couple. Someone was asking before about cameras, especially if the person lives alone. Any thoughts on using cameras?
Yes, like using nanny cam kind of technology. Yes. Oh, I love this question. This is an area, a very gray area. So yeah, if installing a camera in someone's home, right? The person living with dementia certainly needs to be informed that cameras are being installed. You need to tell them if they are being recorded. Whether or not they can remember, right, is a whole other question. They need to be informed. They need to be able to give consent, or their legal representative needs to be able to give consent to that. The tricky thing is that if you're doing this in a private home, there's other people coming and going. In particular, if there are professional caregivers that are working in the home, they're being recorded as well. They also need to be informed, right? They need to know that in their workplace, right, they are being recorded and monitored. So you need to, if they work for an agency, and they should, if you're contact the agency and let them know that you have installed a camera. Some agencies have policies around this and will or will not permit them, or they will get the caregiver to give their consent to being recorded. So it's there's no sort of universally no universally accepted answer there, but permission is absolutely required. Somebody needs to give consent to that. And that goes for in residential care facilities as well. And we can't just install nanny cams, or, people have done like the little teddy bears with cameras to keep an eye on the memory care staff. That is their place of work. While yes, it is also where your loved one lives, it is somebody's place of employment. And if they're being recorded while they're working, they need to give permission for that. So the community needs to be made aware of that. And again, many of them won't grant that consent. Many of them, these days, a lot of communities are being built with cameras installed so that family can turn them on if they want to and watch. That is, there's ethical questions and considerations there, but certainly it is definitely becoming more widespread. This might be, let's see, that question that was emailed in advance. I'm scanning that one real quick. Okay, is it okay if I just read this? I think this was an interesting sort of scenario that somebody emailed in. I put in a particular brand of a camera and an Echo Dot, or the Echo Show, right? The Echo that has the screen in my parents' assisted living. They were not accustomed to and shunned technology in their home, but I didn't ask them when they put these in their rooms. In an assisted living community via staff. We have not been inside since June. So have others used this technology? How are they incorporating it? I use it as a nanny cam to see what's happening before I call or visit. That way I don't disturb them if they're napping. Yeah, again, this is trickier because it's in an assisted living facility. And yes, the assisted living facility absolutely should be informed because even though if you're keeping the camera fixed on your person, other people are going to come into the field of that camera, and they need to be informed that they are being recorded. But I think, if it's working for you as a family, certainly in a private setting, if it's working as a way of getting information or communicating via the Echo, do it. Right, if it's working in your family. If anyone else is using cameras for with positive or negative effects, feel free to share that in the chat. Great. Anything else?
I think that's all we have right now.
Okay. Great. All right. Well, with that, we're right up at our time. If there are specific resources we can connect you with, again, there's lots of good information on our website. Our webinar library has lots of recordings of past education programs, but also lots of tip sheets and other videos and recordings that can provide a lot of disease information and support. If you need resources, such as examples that I've been giving throughout the program here, or you're just in need of some emotional support, you need to talk to a knowledgeable person about what you're experiencing. This is what Brooke and our team of social workers are here for. Give us a call, send an email, info@alzsd.org, or you can fill out the request form, the social work follow-up request form link that Brooke has just put out in the chat. If you fill that out, let us know how to reach you. A member of our team will reach out, even if you don't even know what you need. You just know that you need to talk to somebody. That's totally okay with us. They're really, really good at their jobs, and they'll help you figure out where to start. So please let us know if we can be of support. A couple of upcoming education programs, just want to make sure you're aware of. Our driving and memory loss class is taking place. Driving and memory loss class will take place next week, next Tuesday afternoon. And we also, every other month or so, my colleague Jean Alton and I, my colleague here in the education program, we do what are called open door education hours. We know that Zoom webinar isn't everyone's favorite. It's not our favorite either because we can't see you and we can't talk to you. If you want to just pop in, these are held via Zoom meeting. so we can see you, we can talk to you, we can answer questions and have a discussion. There's no agenda or a specific program. If you just got a question that you want to ask, maybe you watch one of our webinars and it wasn't live, so you came away with a couple of questions. This is a great way to get those questions answered. So feel free to join us at the next one, which is coming up in a couple of weeks. All that information, of course, is on our website. So I'm going to go ahead and close the webinar here shortly. When I do, you'll get directed to a quick survey. We would love your feedback on the program. Thank you to everyone who has participated and shared and asked questions and shared your experiences with us and with each other. That's so valuable. We're always looking for ways to improve our programs, and the survey is quick and it is anonymous, so you can and should be as honest as you can be. And again, the recording of this program hopefully will be available within a couple of days, and we will be emailing out some the slides and some supplemental information as well. Anything else before we wrap up? Okay, with that, I'll wish everyone a good Friday, a good Friday afternoon. Have a great weekend. Thank you again for joining us, and we hope to see you at another program again soon. Take care.
Everyone, thank you.